the new Global AIDS report tells us that the path to ending AIDS is clear, but it's the action to achieve this that is the real challenge for us. The responses that succeed are anchored in strong political leadership to do four things: to tackle the inequalities holding back progress, to enable communities and civil society organizations in their vital role in the response, make them a true partner in implementation, in delivery, in understanding the epidemic and monitoring, to ensure sufficient
Recording
and
in
sustainable
progress.
finance. And finally, it also calls on us to scale up the evidence-based HIV prevention and treatment. We're here today to review the latest evidence from the Asia-Pacific region. In particular, we seek to understand more clearly what the data are telling us about the risks, the realities, and the needs of young populations. That's the men who have sex with men, people who use drugs, sex workers, and transgender people in the 15 to 24 age range. The slide before you shows that in 2022, there were an estimated 6,500,000 people living with HIV in the Asia-Pacific region. And among all the UNAIDS regions, it's the second highest number of people living with HIV after East and Southern Africa. There were an estimated 300,000 new infections last year and 150,000 AIDS-related deaths. Far too many, both new infection and deaths, given the science, the ability to respond. In our region, 4.2 million people were on treatment, far below what we need. In 2022, more than 3/4, or 78% of people living with HIV were diagnosed. Almost 2/3 of people living with HIV were on treatment, 65%. And 62% of people living with HIV had achieved viral suppression. The regional averages on the right of this screen show that for men and women, the levels are about the same, but we are nowhere near the targets, as you can see from this slide, that we need to achieve for any of these areas to help control HIV AIDS as a public health threat. The average treatment coverage for the region stands at 65%. There's been no increase since 2021, and the region lags behind the global average, which is 76%. If we could move to the next slide, please. There are huge variations between countries. While Cambodia, New Zealand, Thailand are treating more than 80% of people living with HIV, as you can see here, quite a number of countries are not even reaching half of the estimated number of people living with HIV in their country. And look, to the reds, the yellows, and the early greens, we have a lot of work to be done at country level to pick up the pace to achieve the treatment coverage needed. This includes Bangladesh, Indonesia, Iran, Mongolia, and the Philippines. And 3 countries covered less than 30% of people living with HIV last year, as you can see on this graph. Then in this slide, you'll see the pink shows the number of people who have been diagnosed but are yet to receive treatment. They're not accessing the treatment they need in a whole range of countries. The key priorities for achieving the testing and treatment targets are to ensure early treatment initiation and to retain people on treatment to achieve viral suppression and undetectable viral load. When people on antiretroviral therapy achieve the undetectable viral load, they are unable to transmit the virus sexually. The concept, as we all know today, undetectable equals untransmissible, or U equals U. We see that some countries such as Bhutan, Cambodia, China, Thailand have mastered this linkage to care, getting 90% or more of people who are aware of their status on treatment. But others, including Afghanistan, Fiji, Indonesia, Iran, are not yet treating 60% of the diagnosed number of people living with HIV. So these are people who know they have HIV and unable for different reasons to access the services. Between 2010 and 2022, new infections in the region declined by only 14%. But this masks a huge range between countries, as you can see in this slide, from those who are declining at high rates, like 77% in Nepal, through to those in countries in the red with seriously rising epidemics. To end the epidemic, we need to significantly slow the stream of new infections. If countries do not take decisive action, we're at risk of seeing a reversal in the prevention gains. The slide here shows Afghanistan, Bangladesh, Fiji, Papua New Guinea, and the Philippines with rising infections. And in the Philippines, 5 times increase in the last period. We also know that the infections are largely amongst men. 70% of new infections in 2022 were among men. But it's also important to make sure that the programming targets at-risk women and those in need of services. New infections in the region are concentrated among key populations. We've known this for some time. That hasn't changed. In 2021, 96% of new infections were among key populations and their sexual partners. Here in this graph, you can see that most of these cases are among men who have sex with men, 46%. According to the report, MSM, transgender people and people who inject drugs have not benefited equally or sufficiently from HIV prevention. And this is a significant challenge for countries in our region. To end the inequalities affecting key populations, we must also apply policy and programmatic solutions that work while removing the structural barriers. The report tells us that new infections in epidemics that are concentrated among key populations are not declining globally. Access to combination prevention and treatment services among key populations remains limited across most of the world. However, we are seeing faster declines among some key populations in some countries. As you can see here, this is a complex set of graphs, but you can have a look at these after, just to see a few examples of countries in our region. But some groups are doing better than others, and it depends on the country. So we need to be looking at the mix. Where is the epidemic occurring, but where are the targeted programs also being matched or not? Of particular concern for our region is the rising epidemic amongst gay and other men who have sex with men in several countries, and the slow decline in others. Next slide. Pre-exposure prophylaxis. We all hear about it. PrEP. It's the antiretroviral therapy taken by an HIV-negative person to avoid contracting the virus. This graph shows you the differences across the region in implementation and uptake. PrEP has serious potential to markedly lower new infections, as we've seen in Australia and New Zealand. In Australia, the state of New South Wales, its most populous state, is looking seriously at being able to end AIDS as a public health threat. They're looking at epidemic control, and PrEP is a significant part of this success. We need countries to pick up the pace and transition from pilot projects to national rollout. The efficacy is proven. There's no time to waste. We will not see the expected payoff unless it is actually implemented at scale in the populations of need. The same structural barriers that affect other prevention services and testing and treatment also create barriers for the provision and uptake of PrEP. 70% of the estimated global need for opiate agonist therapy and opiate substitution programs is in our region. And you can see here in this slide, at the bottom, most countries have very low or medium coverage, reaching less than 40% of the people who inject drugs. And we know the whole variation of what's happening in the drug scene across the region and its impact on HIV. And the intersectionality of drug use and sex in HIV transmission is critical. So we need programs to target a whole range of areas for the use of drugs. The top part of this slide shows that needle and syringe exchange services are also at low to medium levels in several of the countries and not very high in most. We cannot end AIDS among key populations unless we effectively address the societal factors that increase the vulnerability and block the ability to access services. Repealing laws that criminalize or otherwise discriminate against key populations is an urgent human rights and public health imperative. According to the report, knowledge of HIV status and the rates of viral suppression were lower in the countries that criminalize same-sex sexual acts or drug use. In Asia-Pacific, 38 countries criminalize some aspect of sex work, 17 criminalize same-sex relations, 24 criminalize drug possession, 19 still criminalize HIV transmission, exposure, or non-disclosure. And even if it's not implemented, that law is critical to keeping some people away from services. And 15 restrict the entry, stay, or residence of people living with HIV. Access to HIV-related legal services must be ensured, and the communities need education about their rights. Stigma and discrimination has a profound negative impact, as we know, on the health and well-being of everybody, but particularly of key populations, and on the success of AIDS responses for these groups. These are a number of examples from different countries to show the variations across our region. And according to the report, people living with HIV who perceive high levels of stigma and discrimination are more than twice as likely to delay enrollment in care until they're very ill. Our region is also, like the rest of the world, seeing economic jolts, including the impact of COVID, which is still being felt, but it's threatened the world's ability to mobilize the essential resources needed to end AIDS. Countries must summon the political will to apply the resources available. They need to make the essential AIDS investments. In addition, the donor and development base for AIDS and health must be expanded or at least maintained. Funding patterns that contribute to HIV inequalities must be corrected. Resources available for the region are far lower than the investment required to achieve the 2025 targets. And in the next slide, you'll see very clearly Asia-Pacific investments in prevention and the societal enabler programs for key populations fall far short of the estimated total share required. And you can see a whole range of countries on the slides. For Asia and the Pacific, we have 4 priorities to reach the 2025 targets. They're on the next slide, and they focus on, the first of these is the focus on key populations, and that's clear from our presentation and the discussions today. To modernize HIV service delivery. In far too many places, we are seeing old-fashioned programs that do not reach those who are at risk of HIV or in need of services today. To eliminate the equitable program coverage barriers and to mobilize sustainable domestic financing and look at integration where possible. COVID, we saw many investments and we saw many improvements in public health programming. They need to be maintained where they had a positive impact for HIV. We're going to turn now to look at the key issue for today. There are many issues in the report, but importantly, the issue of young key populations. We need to focus in on what the situation is, and we're going to hear from the very good panel who are going to share some ideas, and I hope we're going to see lots of comments and questions in the chat to stimulate this discussion. Across the region, new infections among young people declined by 22% between 2010 and 2022. But this trend is not strong enough to end the region's epidemic by 2030. And remember, every young person who contracts HIV requires treatment, care and support for life over several decades. And to end AIDS, we need to slow the flow of new infections. The young people aged 15 to 24 represent only 15% of the region's population. In some countries, this is a significant boom in terms of population growth. Young key populations, the men who have sex with men, people who use drugs, sex workers and transgender women in this age group, are yet a very small fraction of the youth population. But together with their sexual partners, as you see here, these key populations account for 26% of all new infections in Asia and the Pacific. And you can see the breakup between different age ranges here. The priority for us is to target young key populations. In the next slide, we see in Cambodia, Indonesia, Myanmar, Laos PDR, the Philippines and Thailand, that youth from key populations and their sexual partners make up around half of new infections. So that says something to those making programming decisions. Where do you need to invest and who do you need to work with? In the next slide, we see that since 2010, new infections in the 15 to 24 age group have risen in Afghanistan, Bangladesh, Fiji, and Papua New Guinea and the Philippines. We have some serious issues that need to be addressed in these countries, and a lot of support is required from a whole range of partners. The graph in the next slide shows that young key populations also have inadequate access to prevention services. You need to take time, have a look at the slide later and unpack and see what's happening in different countries by different population groups. There's a lot of rich information available, but you'll see they're to the left. We need them to move to the right of this slide. We have 6 key recommendations for policymakers and HIV programs to address the challenges that young key populations focus. And I hope we're going to hear from our panel their perspectives and the differences they would see. On the screen, you can see for yourself the 6 areas. HIV prevention programs and funding to focus on young key pops. To engage the community, the youth-led organizations in all aspects, planning, implementing and monitoring of programs to ensure they're inclusive and understand the new issues that face young people today. Adopt differentiated service delivery methods to meet the needs and realities of YKP, including maximizing the use of mobile technology, social media and telemedicine. Meet young people where they are, not where we think they should be or where the programs are based. We need to reach out to where young people live and are active. Make access to PrEP, harm reduction, condoms, self-testing kits easier for young key pops. Remove the human rights barriers by reforming laws and policies hampering access to services, and to collect and use the disaggregated data on young key pops for advocacy and for program design and implementation. It's got to be a true partnership with young key population organizations and individuals in all countries. But you can see from the report and the details when you look at your own country what the issues are telling you for yours.